This video explains the brachytherapy recovery process. The explanation includes the recovery timeline. The timeline spans from the initial days post-treatment to long-term management. The video will highlight potential warning signs during recovery. It also provides recovery tips to aid the healing process. Brachytherapy is a form of internal radiation therapy. Tiny radioactive seeds are placed inside or near a tumor during the procedure. This allows for the delivery of high doses of radiation directly to the cancer cells. Brachytherapy minimizes radiation exposure to surrounding healthy tissues. Brachytherapy involves placing radioactive sources directly inside the body. This allows for a high dose of radiation to be delivered to the tumor while sparing surrounding healthy tissue. There are two primary types of brachytherapy, based on the rate of radiation delivery. Low dose rate, LDR. Brachytherapy involves permanently implanting radioactive seeds. High dose rate, HDR. Brachytherapy uses catheters to temporarily place radioactive material. The choice between LDR and HDR depends on the type and location of the cancer. Brachytherapy delivers radiation directly to the tumor site. This targeted approach minimizes radiation exposure to surrounding healthy tissues. Brachytherapy typically involves shorter treatment durations compared to external beam radiation. Patients often experience fewer side effects due to the localized radiation. However, the specific side effects can vary depending on the location of the treatment. The immediate post-treatment period involves a recovery phase as anesthesia diminishes. Patients typically spend a few hours in a recovery area for monitoring. A urinary catheter might be temporarily necessary. Mild pain is commonly experienced near the treatment location. Swelling or bruising around the treatment site is also considered normal. Most patients are eligible for same-day discharge following treatment. An overnight stay may be required for some patients. Patients who receive sedation must arrange for transportation. Driving is prohibited for sedated patients immediately post-treatment. A designated driver ensures the safe return of sedated patients. The early phase typically spans from day 3 to day 7 post-operation. Light activities, such as walking, can be gradually resumed during this period. Lifting heavy objects and engaging in strenuous work should be avoided. Common symptoms may include urinary frequency and a burning sensation. Patients might also experience mild bleeding or fatigue during this early phase. The early recovery phase typically spans from days 3 to 7 post-procedure. Adequate hydration is crucial during this period to support bodily functions. Drinking plenty of fluids helps alleviate urinary discomfort. Increased fluid intake aids in flushing the bladder and preventing complications. Fatigue is a common short-term effect experienced by many individuals. Rest and proper nutrition are essential to combat fatigue and promote healing. Urinary symptoms often intensify during the 2nd and 3rd weeks post-procedure. Symptom severity typically peaks within weeks 2 to 3. Following the peak, a gradual improvement in urinary symptoms is generally observed. Follow-up appointments may be scheduled to monitor recovery. These visits might include imaging or urine tests to assess seed placement and tissue health. Most individuals can resume their normal daily activities within weeks 2 to 4 post-treatment. During this period, it's crucial to refrain from strenuous physical activities. This precaution aids in the body's natural healing and recovery processes. Patients undergoing HDR therapy may require multiple treatment sessions. These sessions are typically scheduled over a period of several days or weeks. The spacing of sessions allows for optimal therapeutic effect and minimizes side effects. Following treatment, patients typically experience continued improvement in their symptoms. This phase usually occurs within the first 1 to 3 months after the completion of the treatment regimen. During this period, some patients may observe mild digestive changes. These changes can manifest as loose stools, indicating altered bowel function. Patients might also experience urgency, characterized by a sudden and compelling need to defecate. In certain cases, Minor rectal bleeding may occur as a temporary side effect. The initial recovery phase typically spans 1 to 3 months post-treatment. During this period, a gradual return to work and daily activities is possible, with necessary precautions. Caution is advised to prevent complications and ensure proper healing. Regular medical checkups are scheduled to monitor the patient's recovery progress. These checkups also help in detecting and managing any potential side effects from the radiation treatment. Early side effects typically diminish within a few months to a year. However, some individuals may experience late effects during long-term recovery. These late effects can include urinary incontinence, impacting bladder control. Erectile dysfunction is another potential late effect, affecting sexual function. Tissue scarring may also occur as a late effect, potentially causing discomfort or functional limitations. Consistent follow-up appointments are crucial for monitoring long-term recovery. The initial follow-up should occur approximately 4 to 6 weeks after the completion of the primary treatment. Subsequent checkups are recommended every 3 months for the first year post-treatment. After the initial year, follow-up appointments can be spaced out to every 6 to 12 months. These routine evaluations allow healthcare providers to track progress and address any potential complications. Adhering to this schedule is essential for optimizing long-term health outcomes. LDR seed implants involve the permanent placement of radioactive seeds inside the body. The radiation emitted by these seeds diminishes rapidly over time. In rare instances, a seed may be expelled in semen following the procedure. Patients are advised to use condoms during initial ejaculations to prevent seed expulsion. Seek medical attention for heavy bleeding or large blood clots in urine or stool. Consult a doctor for severe pain that is not relieved by medication. Immediate medical advice is needed if there is an inability to urinate. Seek medical help for fever, signs of infection, or loss of bladder control. Immediate medical consultation is crucial when specific symptoms arise. Promptly contacting a doctor can significantly impact treatment outcomes. Early intervention can prevent the escalation of health issues. Certain symptoms warrant immediate attention to ensure timely diagnosis. Do not hesitate to seek professional medical advice when concerning symptoms manifest.